We have our own in-house lab, and of course with having 9 physicians running over here, there's nurses, we have nursing assistants, and we have our clerical staff and our billing staff. Actually, what we tried to do is get them a little experience in everything. Wonderful. And so they've worked in the lab and they have experience. Most of them, I think, if we find willing subjects, are able to practice phlebotomy. I think they're able to see how the lab is run. They're able to get vital signs, to learn how to check patients in, to learn how to deal with patients on an upfront basis in a position other than a physician, i.e. they followed our nurses, they followed our lab techs, and they followed our office administrative staff. So I think they're getting a taste of what everybody in the office does, so maybe they can have a little empathy for these people whenever they are a physician and they're dealing with them.
We have a very, very small staff because of what we do and how we do it, but we have a lot of good volunteers. And so for us, it's like having another volunteer in the clinic where they can work in various parts. They can do our triage, they get to see patients, talk with them, hear their complaints, learn how to do a little bit of a history and physical, or at least the history part of it, and some of the physical as they go. And I think that's really been helpful to us because that frees up our little bitty staff to be able to do other things while they're here. There's probably nothing more important, not only in life, and certainly in medicine, than mentoring. And if we don't do it, then I'm afraid they'd lose out, and nobody does it. I think it's imperative that doctors mentor.
And there was a couple times that he'll say, hey, I'd like for you to just follow me around today, and so that he can ask you a few questions. And my favorite is whenever a patient presents with something and he'll ask you, what would you do? What do you do next? And it's generally not that big of a deal because there's so many things that you go through regardless. You're just about always listening to the heart, listening to the lungs. You're checking the lymph nodes, looking in the ears and the nose and stuff. And the part that gets you is when he asks you after that, what would you do next?
A lot of what I do is assisting the nurses in triage. I'll usually get the charts, call the patient back, take vitals, help them elicit the patient narrative and the HBI. And that's on the nursing side. When I'm with the physician, it's somewhat like shadowing in that I'm in the room and watching him do what it is he does. But when there's something interesting, say like a heart arrhythmia or murmur, or if someone has sutures, I've been able to aid in assisting and pulling it out. So it's slightly more interactive. And then outside of the patient room, the physician includes you somewhat in his decision-making process, or at least clues you into how it is he makes decisions, and will bounce ideas off. So in the second week of class when we were learning about alpha and beta blockers, the physician actually started quizzing me on alpha and beta blockers and linked what it is we're doing in the classroom to here.
Probably the best thing about it has really being able to interact with patients and also learn to work with the healthcare team, and not just seeing doctors, but also seeing nurses and office staff and everything else, and learning kind of how they interact and how clinics work. And I'm really interested in doing rural medicine and going back to Coleman, and so this has been a really great opportunity, kind of getting to see an underserved group of people.
Whenever I leave the clinic at the end of the day, I just feel rejuvenated to have seen the things that we're talking about in class, because studying can get on your nerves a lot sometimes. Yeah. I go home and I study after this because I actually think I might remember more things then, because I just feel much more motivated after I leave here.